Hello, my name is Tonya Nicole Williams, and this is my presentation on data-driven approach to healthcare, the pros and cons for CS 520 at the University of West Alabama. What is dehumanization? Dehumanization is the process of stripping away human qualities, such as denying others their individuality and self-esteem. With the rapid increase in medical technology, many basic human qualities surrounding the care of the dying have been lost. The history of medicine was originally the art of personal caring and compassion. Since the Enlightenment, what was originally an art has become more clearly a science. In the 21st century, the science of medicine focuses on curing diseases and thus views death as a defeat. Increasingly, it is the disease and not the individual being treated. Data-driven healthcare. The emergence of data-driven healthcare has presented tremendous opportunities as well as unprecedented challenges. Reducing healthcare costs while improving quality of care, handling complex, ever-changing demographics, and adapting to the rapid increase in globalization of patient care are just a few of the realities facing healthcare providers, insurance, pharmaceutical companies, and government entities today. Beyond improving profits and cutting down on wasted overhead, big data in healthcare is being used to predict epidemics, cure disease, improve quality of life, and avoid preventable deaths. This is leading to groundbreaking work, often by partnerships between medical and data professionals with the potential to peer into the future and identify problems before they happen. One recently formed example of such a partnership is the Pittsburgh Health Data Alliance, which aims to take data from various sources such as medical and insurance records, wearable sensors, genetic data, and even social media use to draw a comprehensive picture of the patient as an individual in order to offer a tailored healthcare package. On the previous slides, we've discussed some of the pros regarding data-driven approaches to healthcare. They are listed on the left column of this slide. They are a new era of medical research, comparing health cases in real time, collaborative data-driven policymaking, slashing claims leakage, and saving lives by studying data. There are also some cons to data-driven approaches to healthcare. They are unstructured data that can be misunderstood. As health IT pros wrangle with these growing volumes of unstructured data, they also need interoperable data from other systems to do the analytics needed, but data generally is dirty and error-prone. The second is interoperability or continuity of data. Interoperability is still a moving target because medical records weren't built with data exchange in mind, so therefore it's a roadblock. Poor awareness of what makes data meaningful. There is a lack of awareness about what makes data meaningful, so it empowers patients. Medical information is complicated. The questions are, how do you bring it down to the patient level and help them use it to manage their acute or chronic conditions? How do you help a physician reach precision using all the available data on a patient? Also, there are the billing and revenue cycle management concerns. One more obstacle to data-driven healthcare is billing and revenue cycle management used by provider groups and hospitals. Instead of paying according to contracts between payers and providers, paying should be for the outcomes that the patient sees. We know that the average cost for a given condition and what it is, and if the provider gets a patient healthy sooner, the provider should get a bonus. And if we publish this data, physicians have incentives to improve care and stay ahead of the competition. A final roadblock we face is legacy systems where data is being held hostage from the patient, from facilities, and is released only for a fee, if it's released at all. In a data-driven world, capturing data accurately requires shifting from a legacy model to one that's open, more innovative, and patient-friendly. One example we can look at for the pros and cons of data-driven healthcare is the opioid epidemic. The opioid crisis has been so difficult to curtail in part because of the inability to integrate data from various stakeholders and systems. With so many players and data sources, today's information is partial, fragmented, and often not actionable. While this disconnect applies directly to the opioid epidemic, it is a systematic problem that affects the healthcare community at large. Better data and analytics can help develop better treatment protocols for a wide array of medical and public health challenges that affect the general public. For opioids, that could be to develop better pain management programs or for better, more targeted remediation and rehabilitation for those that become dependent on these drugs. There are 6 ways that we can diminish dehumanization in the medical setting. The first is to individuate practices. Hospital practices minimize the individuality of doctors and patients. This reduces the ability of doctors to identify with their patients. Getting rid of the white coats and scrubs may encourage a greater sense of empathy between the groups. The second is agency reorientation. In some cases, doctors perceive that patients cannot make their own decisions and consequently treat them more like pets than people. By empowering patients to have a say in their treatment or giving them small tasks like taking care of a plant, they can give patients a better sense of self and authority over their health. The third is promoting similarity. The perceived gap between doctors and patients often reduces the ability of the two to relate. Promoting similarity by hiring more physicians to match national demographics of patients would be a bonus. Physicians refer to clients as people, not as their disorders, as the patient with diabetes rather than the diabetic. The fourth is personification and humanizing procedures. Doctors should refer to patients by their symptoms or particular body parts, and that can make them feel less like people and more like objects. Avoid speaking about patients in ways that mechanics speak about their cars and their broken parts by doctors for patients would be beneficial. Doctors should use more personifying terms to humanize patient care. An example includes reminding the staff of a patient's hobby or family and making the patient's face visible at all times. The fifth is empathic balance and physician selection. Treating patients can sap doctors' capacity to feel empathy for those undergoing painful procedures. By encouraging a balance between cold cognitive problem solving and warm social skills during medical training, physicians can be more effective in clinical settings. Lastly, moral engagement. Doctors separate morals from work to minimize their guilt when they have to give foul-tasting medicine or administer painful procedures. However, this can go too far and subject the patient to unnecessary discomfort. Morally engaging practices such as providing more fashionable hospital gowns or including a photograph of the patient in his or her file can increase humanization. These are the references that were used in the development of this presentation. I hope you enjoyed.